Hi, and welcome to the Gritty Nurse Podcast, an unfiltered discussion related to health and healthcare. My name is Amie.
And my name is Sara.
And we are your podcast hosts. So just remember, we have our Gritty Nurse apparel line. Go to grittynurse.com to subscribe and get yourself some great swag.
And we also want to let all of our listeners know that we have a Patreon account. You can find us on patreon.com/grittynurse. If you're listening on Apple Podcasts, Google, Spotify, Amazon, or any other podcast platform, just be sure to hit subscribe so you can get notification every time we have a new episode. Also, don't forget to rate and review us.
Hi, and welcome everyone. So today I'm so excited for the guest that we have. She is a powerhouse. She is one of the best and most fearless advocates I have ever encountered on Twitter, on CBC, on every news and media platform. She is a beast, and we are so happy that we have her today on the Gritty Nurse podcast. I don't even know what to say, but Sara, can you please introduce our guest today?
Absolutely. So today we have Dr. Vivian Stamatopoulos. She holds a Doctor of Philosophy from York University in sociology. Her research interests include a focus on child and youth-based caregiving, and she's currently collaborating with a team of Canadian researchers on a Social Sciences and Humanities Research Council of Canada funded study exploring the transition of youth to adulthood in the context of caregiving. More importantly, Dr. Stamatopoulos is a long-term care family caregiver researcher and fearless advocate for the conditions that residents and healthcare workers have endured during the COVID-19 pandemic. She has been speaking out on the conditions in long-term care on social media, television, and town halls across the province. Welcome, Vivian.
Thank you for having me.
So
And those
excited
very
that you're
nice
here.
things. Thank you for those very nice things.
Yeah, this is so awesome to have you today. I was just wondering if you could start by telling us a little bit more about yourself and the things that you've been advocating for.
My story is that I was a young adult caregiver for my grandparents. I've always been incredibly close with my grandparents. I've always had a soft spot for seniors, to the point of like having to take time off school, move into their condo to help care for them. I mean, put my life on hold. Because I didn't want to have to put them in long-term care. It got to a point where, and this is all prefaced while I'm trying to finish school and struggling, to do all that and work full time to pay for school. It was a lot, and I ended up changing my dissertation to actually focus on family caregiving because of my experiences as a young adult caregiver and just how overwhelming it was as one of these essential family caregivers. For me, I started because I had experience being a young adult caregiver for my grandparents. I've always had a soft spot for seniors, been very close with my grandparents, and I did as much as I humanly possibly could to keep them out of institutional care, going so far as taking time off school, moving into their condominium to help care for them. I mean, it really put my life really on hold while
Yeah.
finishing grad school, and so much so it impacted my life, this experience of being an essential family caregiver, that I ended up changing my doctoral dissertation halfway through. I mean, I was a political economy globalization student, and I just said,
Oh, wow.
but it all ties together because everything I learned in globalization and how the second wave of globalization was literally on the backs of women from the global south, and it's literally exactly paralleled in long-term care, and that's exactly
Yes.
what we've seen happen in the workforce. So it's like everything connected, and I just transitioned into this caregiving realm of research, and I had been focusing on younger carers, or young carers as we call them, and then the pandemic hits. It got to the point where my grandmother lost her mobility, but we were given slim to no option. I mean, the LIN pretty much said, like, this is a crisis situation. She needs to be in a home. You need to pick one. You can't take care of her on your own. And we didn't know what to do. And
Yeah.
it's the worst decision ever, and you have no time to make it. And they're telling you this is crisis and you have to put her in care. So I did whatever I could to find a home with zero time that I thought would be best for her, and that was the worst decision of my life. So that has unfolded because she ended up passing away in very unfortunate circumstances, and I'm currently fighting what happened there.
I'm
Um,
sorry to hear that.
so I know what so I know what these families are going through, and I know how important it was for us because we made sure that somebody was at that home every single day because of very terrible experiences we had. Within the first few days of her being admitted, she was harmed seriously and had to go to the hospital. I mean, it was bad.
Wow.
Wow,
and
that's
and
crazy.
it was the worst experience of my life. And then you don't know what to do, because you know the wait list, and you don't know, and you think, you think you take their word for it that they'll do better and she'll be safe, and you're still scared. And we made sure somebody was there every day. It was just the worst experience of our life. And we were trying to get my grandfather in with her because they'd never been separated. They were married for 60 years, and then this was the first time they'd ever been separated. But they wouldn't. They said they were full. They couldn't get him in, and we kept trying. It was a nightmare. Everything about it was every bad thing you hear about, families' experiences in long-term care.
Yeah.
And there was not one day we would never not be there, because we just didn't feel comfortable not being
Mhm.
there, and knowing that we would be there to feed her, we would be there to provide that important care, because we saw for ourselves, when we're not there, there's no time in these facilities factored into actually socializing with these individuals, especially the ones that are bedbound. And unfortunately, they for the most part ended up making my grandmother bedbound, because she was a two-person transfer. And if you know anything about these homes, there's never enough care on hand to provide help for two-person transfers. And I didn't know all these things before.
Yeah.
You learn, it's a steep learning curve. So I knew as soon as that outbreak hit, and the no visitor guidelines came down from Dr. David Williams, I knew immediately that was going to spell nightmare for these residents, based on my own
Right.
experiences, based on having talked to other families. Because the second you live through long-term care, you meet about another 10 families that have had another nightmare situation. It's funny how that happens, right? Like
Yeah.
you're surprised, right? Before, nobody talks about long-term care, and then when you live it and you start talking about it, you find another 10 people easily who have another horror story to share. And it's like
Absolutely.
the dirty secret that remains a secret until somebody brings it up.
Right. I really sort of hear what you're saying, Vivian, because my grandmother also was in a long-term care home, and she passed away in April from COVID. So
Oh my
we
God.
we really had no updates, nothing, didn't get to say goodbye. So I really empathize with the experience that you went through, although I feel like yours is different, but we do have a lot of similarities there too.
Well, I mean, that's horrible, because you were right at the front of the pandemic. And the fact that you couldn't be there and you were locked out. I mean, my heart just broke for those families, and I simultaneously wanted to put my head through a wall, knowing
Hmm.
that this short-sighted government, this form of medical elitism by these male doctors, not for nothing, that were levying down these thoughtless procedures without understanding what it's like actually being in these homes. Because
Right.
it's very unlikely in my mind that Dr. David Williams has spent a lot of time in any of these homes and understands the importance of, essential family caregivers to these facilities. Anybody that has experience with these homes knows how important family are.
Yeah, absolutely. Like I completely can empathize with all of what you're saying, and even to some degree with Sarah, because like my grandmother was also in long-term care, and really if we weren't there to feed her, to dress her, to do these various different things, like we were, half the time we'd come in and she wasn't changed, she wasn't dressed. So like
Yep.
we know that there are those same things that we hear over and over again through patient voices and through patient stories, of that lack of transparency, the lack of communication, the
Yep.
lack of staffing. We keep on hearing these same things over and over, but we're not seeing those different results. And really, one of the things that I actually wanted to pull out was a statement by you, which I think is really the truth, and it's really putting it out there. And it was, COVID-19 did not cause the condition within these homes. Rather, it put a spotlight on what's been happening for years. Abso-friggin-lutely.
Yeah.
Like, we have to disrupt the apple cart. We have to say, hey, there are things happening here that needs a lot more supervision, that needs a lot
Mhm.
more oversight, that needs a lot more care and attention. And patients and families are crying out for help, and their voices aren't being heard. But we're going to do them some justice today, make sure that they are heard. Tell us a little bit more about your advocacy.
Yeah, it just kind of started very accidentally. Definitely, I'm not, an inherent advocate, which funny enough, I say
Yes,
this,
you
but I don't ever
are.
think I am. But like, it was funny because right before the pandemic, I was actually, and I only say this because I didn't do any of the level of advocacy I had done at this point, and yet right before the pandemic, I actually I didn't know I was secretly nominated by staff at the Durham Alzheimer's Society for an International Women's Award
Oh my
for
gosh.
advocacy with young carers, and I had no idea. And I was presented that award literally the week before we entered lockdown. So like March,
Oh,
I think it was
wow.
like March 10th.
Congratulations.
Thank you. But I laugh sometimes because I'm like, I didn't even do a hundredth of what I am doing now, and I just thought it was amusing. I mean, I don't, obviously talk about that much, but it was just the sweetest thing. I think I just always had a big mouth whenever I see that something is not right. I was
Yes.
raised in a way to say something, and it's just my personality. I've never been one to. I don't suffer fools gladly, and I don't like bullies. And there's a lot
Yes.
of both, and I have no time for either or.
Oh
Um,
my god, I love you.
no time, and people learn very quickly that that they don't want to knock on this door unless
Right.
unless they're ready for it, because I'm never going to bow down.
But it's the authenticity, right? It's the fact that you have a genuine interest and a genuine sense that you want to help, that you want to see change because you've seen it, you've lived it, and you know what other people are going through. So it is that authenticity that people feel. That's why we can see that what you're doing is, and maybe you don't even realize it, but you're doing
Oh,
so much. I don't even think you know.
that's so sweet. I mean, the thing that's frustrating for me is that I feel like so many people in the world of, let's say, like advocacy proper, or not even advocacy proper, but people that are seemingly the experts in the area were so quiet in the area, particularly at the beginning. And I'm sitting here waiting for these experts, like elder care experts or doctors, to stand up and say, "This is not right. What is happening?" And nobody was. So I was like, okay, well, apparently I have to start screaming because I'm waiting for people to say that, confining seniors isn't cool and it's not
Yep.
okay. And of course, I started just literally rage tweeting, I guess you'd call it, and people and families started messaging me, like direct messaging me and sharing their stories, and then that fueled me because I get very attached to people, and I'm like this with my students too. Like anyone that knows me knows, like there's no bullshit with me. Like what you see is what you get, and I do care. And I
Yes.
would talk to all of these families, and I have been talking to them from the very beginning of the pandemic, and but behind the scenes, I've been connecting. I can't count how many families to different reporters throughout the entire pandemic just to get their stories out there. And I didn't even start talking publicly until a few months after, until people actually started to ask me to give interviews. I was just behind the scenes coordinating and getting these stories out there because
Right.
I needed people to hear what I was hearing. It was important and it was horrible. And these, oh my God, the things I heard from staff in these facilities, from primarily essential family caregivers, and the horrid experiences. Like I talked to several military home families. I mean, what they have been through will never leave them. That will stay with them forever. Like the trauma that I live with for my grandma, it will never leave, and it changes you fundamentally. And I'm just so
Yeah.
angry that these families have had to deal with a minister who has the audacity to get in front of the television and effectively lie to the public and
Mm.
present this image that everything is fine and everyone's doing the best and you're using every measure and every tool.
Yeah.
Respectfully, you are not. And I just, it's so offensive to these families. And,
Mm.
it's just a slap in the face to what they've experienced. And they deserve better.
Absolutely.
Hmm.
Yeah, I hear you.
Yeah, I just wanted to touch upon something that I heard you mention actually in an interview about societal ageism, which is females. So the population overwhelmingly in long-term care homes is female because we know that they live longer, and they're also being cared for by female racialized workers. So I
Yeah.
think you made a really good point there as well, that it's a gender issue and it's ageism. It's a lot of things sort of rolled up into one.
Oh, and there's no doubt. What we are seeing is the trifecta. And I initially said trifecta, but it's actually It's a square, I guess, a square quadrant. That's like the worst way to put it. But like, this is the reflection of the fact that it's a majority female, older population, resident population being cared for. And keep in mind, not only older female, but with disabilities. So ableism is a part that I really need to add in there. And my dear friend Lisa Gretzky, who's an MPP in Windsor, reminded me of that last night in the town hall. So it's ableism, it's ageism, it's sexism, and of course, it's racism, because the majority of these workers in these facilities are women of color, often new to Canada,
Racialized, yeah.
and are being exploited for their labor that is deemed cheap and disposable. And this is a trademark of advanced global predatory capitalism. I mean, this is how the second phase of capitalism unfolded and took hold over the use of gendered and racialized workforces. And nowhere do we see that more succinctly as in long-term care.
Absolutely. Like, holy crap, you are hitting it out of the park today. Like, I mean, all of these things, they're point on. And it's funny that we kind of even got to that part of the situation, because I was actually going to say that in my experience, and I think they say this in nursing, they say long-term care isn't sexy. Okay, well, we don't care whether it's sexy or not. And we know that you have to have a certain type of personality that would draw you to work with elderly people. And I personally believe the people who do pour their hearts and souls into long-term care and are genuinely passionate about it are the people that you want there. They're the people that are those racialized people that are willing to do and kind of put themselves out there to do something extraordinary, because honestly, senior care is wonderful. I can think about just even my grandparents, and primarily my grandmother was in long-term care, and the stories, they are rich with knowledge, and these people are so important, and I feel like we're treating them like they are nothing. And it is
Absolutely.
saddening to me.
Yeah.
So, as of today, there are 233 outbreaks at Ontario long term homes as of Monday. More than 2,800 of the 4,676 people who have died after contracting COVID-19 have been residents of long term care homes.
Yeah.
Could you give us a little bit of an overview of the long term care situation as you know it?
Well, it's a disaster. So, as you said, right now we have more homes in outbreak than at any stage, at any point of this pandemic. So, we are
Hmm.
surpassing the terrible statistics that we had in the first wave. And the worst part is that this was predictable. We knew that this was going to happen. We were warning this government for months upon months to heed the recommendations of the long-term care commissioners, but also, and keep in mind, the recommendations from the commissioners came from experts and advocates who were telling them what needed to happen and have been raising these, flags for
Yes.
months upon months. I have been screaming into a void for I can't even tell you how long now, repeating the
Yeah.
same messages. I've never in my life more felt that I was a broken record than I am trying to, make anything, stick in Mary Lee Fullerton's craw, quite frankly.
Amazing. Oh my goodness. To me, it's mind-boggling, right? Because, like, I think, yes, I threw out a whole bunch of stats, but one of the things that even I tweeted about today is, so 62 residents have died.
Yeah, the
We
tender
don't
care.
what what are their names? Who are they? They're people, right?
Yeah, it's
They
so
aren't just
heartbreaking.
stats. These are people's lives.
And I think what made me really upset tonight was watching Mary Lee yet again do another terrible, embarrassing interview. Because they're all embarrassing and they all make her look horrid, quite frankly. And where she effectively said, like, "Oh, well, I'm here to talk about the numbers. I'm here to talk
Yeah,
about the
that's
statistics."
horrible.
Like, you
Mhm.
refuse to acknowledge the pain these families have experienced. I mean, we invited her to this town hall that we held last night. We really wanted her to come and hear what these families want her to hear. They want to talk to her. We have been, and they have been emailing her. Keep in mind, it's not just us reaching out on Twitter, a couple of days before this town hall. I mean, she has been inundated with messages from not only tender care families, but families across Ontario. I know they tell me, so this, often they CC me on the emails, so I'm very aware. And 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 yet nothing from her, no recognition that these were families that were learning on Christmas Day that their loved ones died, were being told improper information about their loved ones, like incorrect medical information. Didn't hear anything from the home for days at a time. Some found out their loved ones were diagnosed with COVID a week after the diagnosis. I mean, it's just one thing after another. But I think the worst part is that, like Tender Care, like Sunnycrest, two homes that were consumed by outbreak, horrendous outbreaks, mass casualty situations, where we had inspectors in those homes very clearly document in black and white in published inspection reports clear negligence, preventable error that aggravated, if not caused, these outbreaks. And we still have not heard one word from this minister holding to account these homes, admonishing them for this clear negligence and preventable deaths and the pain that these families are feeling right now. Nothing. Nothing.
Yeah.
We have the equivalent of a downed plane, of a pileup on the 401, and nothing. No press conferences from our premier, from our minister of long-term care. You tell me, if this happened in a daycare, if a handful of children, let alone 62 children, died at one daycare, you can imagine the outcry. That daycare would be
Right.
shut down immediately. Those people would probably be jailed, and they would never be given, furthermore, for more money to create more daycares. And yet we're hearing that not only are they letting these guys off the hook, these bad actors, but they're rewarding them with more beds. We heard Orchard Villas being given more money. Southbridge is being given more money to create more beds. Southbridge, which has one of the worst death records, which was just revealed by a CBC Marketplace investigation. That team is amazing, the work that they do. And yet we're rewarding them. This is astonishing to me, that we live in this world where and it's not even this world, because most of society is disgusted with what they're seeing. Let me
Yeah.
correct my rage here. It is directed primarily to this government that has willfully and decidedly turned a complete eye against. They do not want to. They refuse to acknowledge what's happening, but they know what's happening. They know, and that's the worst part.
Yikes.
I know. I really feel for when you tell an elderly person that they're going to a long-term care home, their first reaction is always like, "You're going to send me here to die," right? This
Yeah,
is what I just keep thinking. And
yeah.
we can't lie to them, because honestly sometimes that is the case. And what are we doing with our elderly? In a lot of other cultures around the world, we hold the elderly to the highest standard. They are the most respected member of their family, but it's almost like flipped on its head here. And I feel like there are so many issues, as you said, that this pandemic has uncovered. I'm just wondering if you have any insight as to what might be some of the root causes of all of these issues. Like, what is really this boiling down to?
Well, if I'm going to pick one single factor, I would say privatization. That's what I
Yep.
would say.
Money,
Because 20
money,
years
money.
ago, yeah, these
Hmm.
homes were a much different place. They were staffed primarily by nurses, hence the term nursing home. And then you see Mike Harris comes along, Order of Ontario, most
Oh God.
disgusting award. I can't even wrap my head around that. That was so despicable. So of course, but that would make sense that this government would give him an award. I mean, of course they would, right? Who's next? Paul Bernardo,
Oh my
civilian
God.
of the year? No, I'm serious. This is
No,
freaking
no, I hear you.
ridiculous. It's just like, literally people that have been responsible for deaths. I can't. It's just horrid. And then
Yeah.
we see that Mike Harris comes around and decides, I'm going to build 20,000 beds. But what I'm going to do is I'm going to set myself up for the future. Probably arrange some quid pro quo deals on the side, where that I'm
Hmm.
going to give the majority of the contracts to the for-profit sector, and that's what he did. And then lo and behold, conveniently benefits from that, those choices by being awarded a board position for Chartwell, making over 200,000 a year in this part-time gig. So yeah, and now we have the most privatized long-term care sector across Canada. We're the worst, which is
Yeah.
why we're seeing what's happening here. And you saw that when these for-profit companies took hold, everything changed. The staffing mix flipped on its head. So it was
Yeah.
majority nurses, peppered with a few resident, care aides, or the equivalent of a PSW. And then within 20 years, it has completely switched. Now, the vast majority of workers, about I think 58% of the workforce, is personal support workers. And then, now I think it's about 25% that are nurses. I mean, this is like, it's completely flipped on its head. And
Yeah.
now, to add insult to injury, and keep in mind, of course, when people try to say, oh, well, that has nothing to do with making profits, get out of here. Everybody who knows anything knows if you're going to create costs, you're going to create profit, you do it first and foremost by cutting on labor. And this is exactly what they did, right? So you create a cheaper designation of unregulated workers. And I'm not, of course, I'm not trying to, put down the workers here. This is the structure. This is the fact that you have decidedly chosen away from a regulated profession that earns more because you want to find a way to pay workers less. So then you
Mhm.
start hiring this new category of PSWs, personal support workers. Then it becomes the norm. And then to add insult to injury, they have now, and we saw this happening throughout the pandemic. So Chartwell, I went through the Long-Term Care Commission transcripts, because I'm a loser like that. So I found that Chartwell was pushing for this resident care categorization, this new categorization. And interestingly enough, Mary Lee Fullerton, because she's beholden to the for-profit lobby sector, one of the only policies we see come out of her is a resident care um, staffing program launched in, I think, November 9th to get
Right.
recently displaced hospitality and retail and service workers, because that's the smart move here, to get people with no healthcare experience and put them in the most vulnerable sector. Yeah, that doesn't spell disaster. Are
Hmm.
you kidding me? But because it's another way to de-skill this labor, it's just part and parcel of the race to the bottom that is privatized long-term care. And it's just horrendous. And keep in mind, this for-profit lobby sector is also behind, pushing for an end to these inspections, because, oh, it's, heaven forbid, it's a pain in the butt to have to do inspections. And we actually saw the Ontario Long-Term Care Association, who, by the way, briefly blocked me. That was fun. Was kind of known to be affiliated with the for-profit lobby sector. I mean, people will go. So there's lots of articles written about how they represent the for-profit lobby sector. It's not me saying it. This is out there, and
Right.
they too were saying, we're putting in those calls for less inspections because inspections were wasting time during the pandemic. Really? Because inspections actually could save lives, but okay then.
Yeah.
So all of these things that, ultimately resulted in this very compromised care, lack of oversight and accountability, um, and the complete reduction of staffing, and the fact that these women are thrown in these conditions where there's no staffing standards, because yes, my care's got rid of those too. So
Hmm.
now we have, one worker responsible for 20, 30 residents. It's just untenable. You are thrown in conditions where you're designed to fail and you're making a pittance. So what do you expect? You're going to have a revolving door of workers. And that's exactly what we have. And what is not good for continuity of care? Like having new staff all the time, because staff get to know the residents. So it's important
Right.
to have permanent, continuous workers who know the needs of their residents. It is not good for anyone to have a continuous revolving door. And that's what we have, because you don't appreciate these workers. You don't train them properly. The majority of the workforce is an unregulated profession, which also, we won't even get into the sidebar of how they're using temp agency to avoid having to actually hire permanent staff in a lot of these homes. So
Yep.
then we have another layer of, precaritization of this workforce through that arm. And it's just horrifying. This should not be happening. This has been allowed to happen because this sector is so well connected with this government, and not just this government, other governments,
Yeah.
but particularly this government. There have been numerous releases and reports about how many previous board staffers are now full-time lobbyists with the for-profit sector. We know that James Schlegel himself, who's on the incident management system, and he runs the Schlegel for-profit long-term care homes, he is now a high-ranking member on the pandemic planning table, helping to steer the direction. Yet his home right now, the village of St. Clair in Windsor, is on fire. You
Yeah.
heard about what happened there.
Oh, yes. Yes.
So
Yes.
yeah, I mean, and he's been a huge contributor to Christine Elliott and to the PCs. The vast majority of his donations have gone to the PCs. And these are the people that end up sitting, getting the power and actually steering the direction. And then you wonder why we have a disaster unfolding before us, because we do not have the right people in place, making decisions that actually benefit the workers and the residents. We have people protecting the industry.
Yeah, I mean, just this year, a controversy, well, not this year, it would have been last year, but a controversial piece of legislation allowing for greater protection of Ontario long-term care providers when it comes to liability claims has passed at Queen's Park. So that was Bill
Oh,
218.
218. I know all about that.
So, I mean, like,
Oh, yeah.
I that again could be a whole episode in itself. It's just not like it's just not fair. It's not right. It's when I heard about it and I was kind of reading into it, I was like, "Oh my god, like this is not okay. And
No.
how are we allowing this to actually occur?" And it's just like time and time again I'm like, does Ford care about anybody other than himself and the privileged people that he
Yeah.
surrounds himself by?
Well, I mean, the devil's in the details, and it's very
Right.
clear who he's been protecting. I mean, give me a break, Bill 218. And I had a special panel after that bill passed with long-term care lawyers and families from Orchard Villa that had experienced this to really go over the problems with this bill and just how disgusting it was, quite frankly. And people are not on board with this. But unfortunately, we have a majority government. And what I really think is despicable is that the rest of the PCs that voted for this, like, shame on you. You know that this was below board. You know that this was not okay. You just go, I'm sorry, but if there's a definition for sheep, I mean, find me a better one than people that are blatantly voting for things that they have to know are
Mhm.
below, are just, there's no moral compass here. This is not
Yeah.
okay. I mean, this is not partisan politics here. There's right and there's wrong. There are some things that are really, you're on the right side of this or you're on the wrong side of this. And anyone who voted for this is on the wrong side of history. Because if you can force through a piece of legislation in under a month, protecting both yourself and the sector from liability, meanwhile, you had 10 months to do what we were telling you to help prevent these preventable deaths, and you didn't. But the only things you have done, aka Bill 218 and this low wage profiteering resident care aid program that they've announced, I mean, all that does is benefit the lobby, the for
Right.
profit lobby sector. This is a very powerful sector that is very well connected.
You said it. Like, I mean, it's it's really, really fearful actually. It's very concerning.
It is.
Some really powerful words, Vivian. Thank you.
Every time I think about it, it's just like I don't know, like Doug Ford doesn't like teachers. I don't know.
Oh,
Maybe I'm saying maybe that's wrong. Doug
no,
Ford
it's not
doesn't like
wrong.
nurses. I don't think he like it's just like
Doug
one thing
Ford,
after the
yeah.
other.
Well, Doug Ford picks on female dominated professions.
It's just
Well, what's the commonality there? What's the
women,
commonality?
women.
Women. These are
Yeah, I
female
know.
dominated professions, female dominated populations. I'm sorry, but it is what it is. Like, look at the policies, look at who has been targeted. This is out there for you to see. This is not a question of, am I just reading too much into this? No, this is what it is.
We actually talked about misogyny in medicine because we see it there a lot too, and I could only imagine the misogyny in politics. I'm sure it's more than rampant.
Oh, yeah.
Um, so we touched on a lot of various different things, and I mean, we could probably go for a long time with this episode, but what are some of the tangible things that we and others can do to create change? I know advocacy is one, us talking and having these powerful conversations is one, but what are some other things that we can do to create change, to bring agency to these patients and families? Because I believe that patient and family voice is highly important. And I don't know if they're getting the spotlight that they need, but what else can we and others do? Because we have nurses that listen, we have patients and families that listen to our podcast. We have health professionals. What else can we do? Because I know health professionals are also like saying, "Hey, we're here." There are primary care physicians. There's lots of people that are like, "Hey, knock on our door.
I
We're
know.
ready and willing." But what else can others do to create change?
See, I always wish I had better answers for this because, like, I'm not a professional advocate per se. So I feel like I never know what the right answer is because, like, I'm also banging my head against the wall, not knowing what to do. All I've been trying to do is just get it out there. not let these stories, unfortunately, and say this, die with these poor families, with these poor residents. And I want to shame and blame a government responsible for this. And I do not, I'm not here to make friends, right? I did not come here that's not what I do. I'm here for the families and for the residents and for the
Right.
workers. And all just be loud is what I could say. Get your voice out there, do the typical, contact your MPPs, contact Fullerton, the premier. We've been trying to arrange protests, things like that, but everything we've been doing is just, this is the problem. We feel like it gets you nowhere with the majority government that refuses to listen and has just shown time after time that seniors are not a priority and they are an acceptable loss of this pandemic.
Yeah. I know
Hmm.
I did see some conversations about, and maybe I'm kind of diverging a little bit, but some discussion about having the military coming back. So we know the military came in April and May. They filed their report revealing the horrific conditions in the Ontario long-term care homes. But is there some way that like we can have them come back? Like I don't I
Yeah, that's what I want, and I have been very clear about that. And I've been hammering that point home in every interview that we need the military and the Red Cross back in there, not just one or the other. Because we were hearing that, oh, we're bringing the Red Cross, but the Red Cross have a very limited scope of practice. They can actually provide healthcare, medical care. The
right,
military teams have nurses, right? So that's why I've been pushing for the military teams to get back in there. And our prime minister has said he's more than happy to send the help. He just needs Premier Ford to make the call. Why hasn't he
right.
made the call? Does he not want the spotlight shone again into the fact that very little has changed from wave one? Does he
Mhm.
want that, or does he want it? It'll actually probably show that things have gotten worse because no lessons were learned, and there was no proactive, attempt to safeguard these particular homes by their owners. I mean, the ones that are failing are majority for profit. It's the same people that failed in the first wave are failing again, and I don't think they want the public scrutiny. And it's just really upsetting that you will forego suffering because, I mean, these exploding outbreaks have, some words. 60 staff right now at St. George Care are off sick. Who's filling in for those workers? 60.
Oh my gosh.
How,
Yeah.
you tell me how the poor residents in that facility are going to get some sort of basic care with 60 staff gone, and only did they send in help today. How does it get to a place where you have this level of 100 residents effectively sick, and 60 staff sick, and you're only sending in help as of today? And this is what we've seen time and time again, a reactionary response when the house is already on fire, and you're doing nothing proactively to help save these seniors. And
Yeah.
I wish I had a better answer for what to do. We're really getting to the point now of trying to plead with Justin Trudeau to really, because he has power in terms of national standards. He's the one giving out the money in terms of the Canada Health transfers. He can assign targeted standards to that money. Key things like the 4-hour care standard, not in 5 years. That's offensive. We need it now. Um, why we need him to step up. We need more stringent penalties for these bad actors. He had floated the idea of criminal charges, of amending the criminal code to hold these bad actors, quote unquote, accountable. Absolutely, I am 100% down for that, because right now these homes have zero incentive to change their ways with written violations that effectively just line the wallpaper of these CEOs' offices. What, really? You're going to give people a written citation and then expect them to change?
Yeah.
Come on.
I think this is where for me, yeah, no, and I hear that, and I think this is for like when I put my nursing hat on and um like my quality hat on, I kind of think to myself, what is it that I would be seeking out um from others in terms of to create change. And one thing is collaboration and strength in numbers. I think patient and family voice in those stories are really, really powerful. I think the more people that come forward with their stories and their experiences and bring these situations to life, because I feel that I feel that people are losing sight that the fact that these are human beings, these are human lives
Yeah.
that we're dealing with. We're seeing so many of the numbers, so many of the stats, and we need to hear it right from the patient experience standpoint. And I think when we also pull into the aspect of patient safety, if we are pulling in the fact that we are putting people's lives at risk, there is jeopardy of a lost life. We have to validate that. We have to validate people's experiences. This is a terrible time. And it doesn't matter whether you're 80 years old. A life is a life, and I think hearing patient stories and patient voice is so important, and having those essential caregivers being able to go in are is important as well. I'm a
Oh,
huge advocate
yeah.
of making sure that, because that also is about patient safety. If
There's
you
no
can have
question.
the right people in to help take care of their loved ones, they are essential, and they
Yeah.
need to be there to help deliver that care, especially if no one else is able or willing to do it, or don't have capacity to do it.
Yeah.
So maybe one of the things that I would suggest is to continue for patients and families to lift their voices and to share their concerns and to tell their stories. I feel that that is so important, and to continue to doing that. Eh, But we do need some form of collaboration. I don't know how we're going to get there, because I see and I hear all of the various different things that are happening with this government, and I think people are going to have a long memory. Like, I know, I'm pretty sure that we have to find, I'm not even saying it has to be a middle ground, but we need to collaborate to see change. We need people to continue to lift their voices. We need to continue to put the pressure on. We need to continue to push forward to see change happen. And I think we're seeing that through your powerful voice, various different other people's powerful voices, and definitely through the patient voice and patient experience.
Yeah. No, I agree. I agree.
Yeah, I think we've touched on a lot of issues, and I'm really thankful, Vivian, that even though maybe you were an unwilling or maybe this was unplanned in your sort of career, I think you are an excellent advocate. I think you definitely speak your mind. You're speaking for those that can't speak for themselves, and that's really what we want to
Absolutely.
do here at the Gritty Nurse is just amplify voices and speak for those who don't have that ability. So, we found you on social media. I know you're very active that way. For our listeners listening today, where can they find you if they want to connect with you or they want to support your cause or just sort of see where you're at with this?
Or they want to give you a
Twitter.
story.
Twitter is the way to find me. That's how and I do want to point, sorry, one thing out that you had mentioned and you reminded me of is that, and I'm not the kind of person that likes to speak for others, but the fact of the matter is that so many families are afraid of coming forward
Yes.
because their loved one is effectively trapped in these facilities, and they're worried what'll happen
Yep.
in terms of retaliation. So I've whenever people have been willing to speak up, I have been sending them, getting their voice out there. I don't want to speak for them, but the only reason I've had to be their voice is because the fear is overwhelming. This is the number
Mhm.
one thing I hear from families, that they're afraid to speak up for fear of retaliation. And there have been homes that have actively retaliated, going as far as using trespass orders on members of family. I
Wow.
mean, so there is a
Wow.
real fear. Yeah, I mean, and it happens. And I know families who have put hidden cameras in their loved ones' rooms and have seen rises in abuse, after they've been raising alarm bells and expressing concerns with the home, and then degraded care. So I mean, not for nothing, they have reasons to be fearful, and I understand why they often, and the truth is, often don't speak up until their loved one is passed, because they're afraid of what will happen if they speak up.
Right. No, I totally get that. And I think the one thing I can encourage others is your voice is powerful. And I think people don't understand how powerful their voices are. And I understand that you're afraid. There's various different ways to go about it in terms of giving your story anonymously, and I'm sure lots of other avenues will be able to take that and do something with it. Because, for example, just with myself and Sarah being the Gritty Nurse podcast, we actually get um, stories from other people telling us their experiences, and we're happy to bring those stories to life, and to bring meaning to them. And I get the fear of that retaliation. It's real, and I understand it and appreciate that. But there's nothing more powerful than solidarity,
Yeah.
and people coming together to say we need to do something different.
No, I agree. And and one of the sweetest things that I can say that has come from my advocacy is just not only meeting these families, but hearing them say that they have found a community of others through through my Twitter, because it's often
Yes.
long-term care families, and then they'll comment throughout the posts, and then they'll find each other, and then they'll create communities outside of that, and that brings me uh so much joy, because they
Yeah.
feel so alone otherwise. And if that's the one good thing that think, there is actually some good that can come from social media. Who knew? And
Yeah.
I think when it comes to Twitter, and in terms of my God, my advocacy would not occur without Twitter. I mean, especially during this age of the pandemic, right? This has all been online,
Yeah.
with the exception of the tender care protest. But yeah, I mean, yeah,
I
yeah,
think I think the biggest takeaway is there's still so much to learn, but we can make it right.
yeah.
So let's
We
try
have
to
to.
make it right.
Yeah,
We
we
got to
have to.
fix it. We got to make it right.
Yep, I agree. I'm with you.
We're with you too.